Hello and welcome to the Prune Tree Podcast live, coming streaming to you live here on Facebook and YouTube from Reinvent South Stockton's Coalition. How do I community conversation? And listen, we're talking about Black breastfeeding today and how it supports our family unit. This beautiful event is brought to you by Health Plan of San Joaquin, who has sponsored this event today, as well as Reinvent South Stockton's Coalition's Black Birth Equity Initiative. And to my right, I have a phenomenal woman, Dr. Astrid Williams, an expert in public health. She has a wide range of experiences in chronic disease and maternal and reproductive health. She is particularly passionate about women's health issues and how they relate to women of color. And significantly, a portion of her work involves developing public policies that address community level health and social issues using evidence based practices. She currently serves as the Director of Programs and Initiatives for California Black Health Network and oversees the Conscious Black Beauty Movement. Dr. Williams advocates for beauty justice, working to phase out toxins in hair care and cosmetic products. She also works to shift cultural norms, favoring harmful beauty standards in communities of color. Dr. Williams is most passionate about her toxins in the built environment and from personal care products affect reproductive health. Dr. Williams is a leader and a community advocate who openly shares how environmental toxins can have a direct effect on reproductive health. Welcome, Queen. Let's go.
Thank you so much. Thank you so much for
Yes.
inviting us here today for Reinvent South Stockton Coalition,
Thank you.
celebrating Black Breastfeeding Awareness Month, which is so near and dear to me. I was a breastfeeding mom for many, many years. I have three boys, and so breastfed them quite long for each of those. So thank you so much. And inviting the California Black Health Network to be able to share with you for this event. And so just to share with you a little bit more about who we are with CBHN, we conduct education, outreach, and advocacy to advance health equity for all Black Californians and immigrants throughout the state of California. And so we are the trusted voice of and a resource, I might add, for Black health equity in the state of California, and the only Black-led nonprofit organization that is dedicated to advancing the health for all African Americans and Black immigrants.
I love it. Y'all can clap it up. So we're here, and you all are a sponsor of this event. And this How Do I campaign, what brought us to this moment, especially here in California? Why are we here? Why are we talking about this today?
Yes, it's very relevant because we have a healthcare issue, particularly for the state of California. We have one of the highest rates of Black infant mortality and mortality rates. And so we want to close that gap and that inequity. We want to ensure that mothers have the treatment that they deserve and the care. And so, how do I achieve that or aims to achieve that goal? And so, it's part of its commitment by the California Healthcare Foundation, which we have partnered with for this How Do I convening here today. So we're doing a series of these in community conversations through our How Do I campaign. We also have online webinars that we've also unveiled. But for this event here and celebrating Black Breastfeeding Month, we want to be able to empower Black birthing individuals and breastfeeding individuals in their journey to be able to have better health care for themselves and also for their families. Just to share a little bit more about the How Do I campaign, they partner with Eviderus, which is a Black firm based in Los Angeles, California, and they conducted qualitative and quantitative study listening to Black California report, which was an in-depth report where they had focus groups in a statewide survey. They published this listening to Black California report, and what they found is that we want to be a part, take an active role in
That's
our
right.
healthcare system, making decisions on behalf of ourselves. And so that's where the How Do I campaign comes in, to be able to empower individuals to be able to be advocates for themselves, for their loved ones, and also for others that they want to be able to navigate the healthcare system with that.
And I know it's hard sometimes, especially when maybe you're just having your first baby. It's a lot of our cultural traditions too that's passed down on how to support us. A lot of you all don't know, but before this doula trend thing was a big thing, we had black midwifery. Come on. It was replaced by, I'm going to say, I'm not going to say it because I'm going to be good, but it was white gynecologists that capitalized on the black need of the mother. It was us that actually cared for our loved ones through black midwifery. And a lot of times we don't have that voice in the room. And there's cultural biases sometimes that are in that room that we have to fight against. There's policies and procedures that are systemic in racism. Let's talk about it. And so, how to understand our patient rights, I think, is one of the biggest things ever. Talk to me about that.
Yes, so I'm so glad that you asked. How Do I campaign talks about that. So we have a five-part webinar series which we unveiled last month in September, and that was the first one, a part of the series, which was patient rights. And so we talked about a lot. The facilitator, I should say, was Dr. Glenda Newell Harris, and she's a family medicine physician that's well renowned in her field. And so she walked us through, how to advocate, what to know about your patient's rights, because there is a patient bill of rights, and a lot of times we don't know how to advocate for ourselves and what we can do in those instances where we feel that we're mistreated or we're
Yes.
discriminated a part of. And just yesterday, we continued on with that series. And so, part two of that was how to communicate with your healthcare provider.
Yes. And a lot of times we can become frustrated. I think that's why we want our doulas in the room. We want our CHWs to be able to coach us and let us know and connect us to the resources. A lot of people don't know, but you can put a complaint in. Let's just talk about it.
That is so true. Yes, you can file a complaint.
Hmm.
And also, you can fire your healthcare provider.
Well, come
So if
on.
you feel that you're being discriminated or not getting the care you want, what you can do is request, based off of your insurance, go and request another provider for that. What I would say is make sure that you have one that's already in queue so you can make that transition quite easy.
Come on.
And then you go over to have your medical records, your tests, your lab results, and all of those things transferred with you. And then I would also add that you should tell the office, or you should tell the provider and their team the reasons why you're transferring, so that they can be able to be held responsible and accountable. And hopefully, as a result, they would, change, in terms of how they're conducting their business, their practices, to help others that they may, also encounter with too.
So tell me, doctor, a lot of times as a mental health therapist throughout the years, also as a medical social worker, working in the hospitals, working for people who may not understand the Black plight and what we've gone through in maternal health. How do we support, even in this campaign, education and cultural humility to be able to hear? Let me say that again, right? Active listening.
Yes.
Come on now. You can be in a room and not be present. But how do we support our care providers and those that are providing for our mothers? What would you say to them in this moment?
Well, I think it first starts with us in our community and making sure that we're going into those fields of STEM and medicine so that we can have providers that look like us, because we're going to be able to know our unique needs, cultural sensitivity, and be able to treat us. And so I think it starts with us promoting those fields of healthcare. And there's whether it be allied, health, because it's a team, it's a healthcare team out there. So I would say, going into those fields, making sure that we select providers, based off a choice, that look like us, so we can feel, that we're being seen and we're being heard. There's so many stories I encounter, such as with Serena Williams. I don't know, you heard
Yes.
about her
Yes.
story, after she delivered, as being a Black woman,
Yes.
a lot of her, symptoms were dismissed.
Yes.
And, it could have ended in a whole different
A
story.
whole different way. She had blood clots, y'all. And when we talk about blood clots, they can travel anywhere. When we're looking at our system, right? And it come all the blood that flows through our body goes to vital organs as well. We could have lost Serena,
Yeah.
just like we've lost a lot of other women that have meant so much to us. We've lost them. just simply them not being listened to or heard.
So it goes back to your original question: what should we do in this instance? So having seeking out those that look like us, but also I would say training for the staff. There's a lot of implicit bias
Mm.
that's in the healthcare system in there. That we get dismissed. That we can endure pain more than any other race or
I heard it.
ethnicity.
I heard that before.
Yes.
Or our skin is thicker
Yes.
and we got a high pain tolerance. Let me tell you, all the books on gynecology back from those 1800s when they were working on what are our mothers of gynecology that were worked on without any anesthesia. If nobody didn't tell you about that history, Rebel Ray gonna tell you, and I'm gonna tell you the truth. Black women have gone through so much pain and strife just for medicine. They learned about us by operating on us while we were awake with no pain management.
Think about Henrietta Lacks too, using
Yes.
ourselves
Yes,
without our
using
knowledge, yeah,
ourselves.
without knowledge, for advancement of research. So these are some things where we're, mistreated. We're not given the right and fair treatment, and also disclosing full, treatment of what's being done. And so this is why we have to advocate. And through the How Do I campaign, we teach you, through the webinars, through these community events, having these, sessions where we can listen to one another and being able to share our stories about how to navigate the healthcare system, how to, raise up patient rights, how to, select a provider, making sure that it's a good fit for you, and also, being a part of that decision making, system as well.
Ashe, thank you, Queen. Now, tell us, how do we keep a hold of you? Down here we're getting activated in the San Joaquin County. Josh Harder was just on talking about exactly that our rates are almost four times more than that average when it comes to infant mortality and maternal deaths. So, how do we get a hold of you? How do we follow you? How do we activate in this campaign?
Yes, and so the How Do I campaign, you can get an follow us online. Go into our website, which is CaliforniaBlackHealthNetwork.org. Also on all of our socials, we're your YOUR capital CBHN. Also on LinkedIn, we're very active and out there, and so it's California Black Health Network as well. And so hopefully, you will follow us online. On the website, I will mention there's a wealth of information for the campaign as well. You can have fact sheets that are downloadable, and tools and resources for different things that we touched on here today about patient rights and advocacies, and how to navigate through the healthcare system. So I would definitely encourage you to go into our website to visit to see the information and resources that we have available.
Ashe Queen. Now, one more time, can you please plug where we're going to find about your campaign for health and beauty? Listen,
Yeah.
that was amazing when I read your bio. I said, I didn't know that. That's wonderful. So, our standards, some of the things that y'all don't know about, that formaldehyde that's in that braiding, in your braiding hair, that's being put into your body. Those plastics are being absorbed into your body and those chemicals, right? Can you plug real quickly about your work
In
in
utero
harmful
too
beauty?
as well. So if you touch on that, so relevant to the conversations today, talking about black birthing individuals and breastfeeding individuals. So what you take in during pregnancy in utero also, crosses that placental membrane as well.
Mm,
And so a lot of times we don't think, oh, okay, well, what we put on our hair or what we
right.
put on our body and our skin is
Hmm.
going to affect our unborn, fetus, but it does.
It does.
Yes.
And I know we have higher fibroid, cyst, and other ovarian cancer rates higher than a lot of our counterparts as well. And a lot of those are just absorbing that those chemicals. And so we have to be
Yes.
cognizant. Yes, with my bleach blonde hair, but listen, I kept it curly. All right. All right, all right. I love you. Thank you for coming out all this way to be with us. Please join us in our campaign, How Do I? And reach out to us at rssccoalition.org. And please follow Dr. Astrid Williams on her public health campaign. We thank you so much for coming.
Thank you so much.
So right after this, we're going to be having our next community conversations and power talks. And so I want you all to remain calm. We'll be back in 5 minutes. Thank you. And children. We know that our children are dying and our mothers are dying almost four times the rate here in San Joaquin County. And during Black Breastfeeding Month here, during Black Maternal Health, we are just uplifting our community. And so we're here with one of our activists that we're going to hear a little bit later on, Miss Erica. Thank you for joining me on stage. We're going to do two raffles because this is a baby shower and we want to hear from our community members. We want to get back to a lot of our power talks. So we're going to ask you to limit it to 2 minutes if possible. But I have a number here, and the number is 002292.
All right.
Okay.
Who is that?
Is that anybody? 002292. All right, come on up, Queen.
Woo!
The price is right. Come on up, Queen. Come on up. You can bring your bag too. Bring your bag. Show us what our mother's got. You just join us right here. Oh, you brought your little princess. I love it.
Hi,
Hi,
everyone.
Mama. So you're gonna talk into the mic because we're streaming
Hi.
for our community members. Testing one, two. Okay, just bring it straight
So
to your mic.
soft spoken, okay.
I love it. What's your name, Queen?
I'm Kia Edwards.
Nice to meet you, Kia. And who's our little princess?
Yes, this Rhythm.
Hi,
She's 3 years
Rhythm.
old.
Oh, I'm so glad that you're here.
She's big
And so,
sister.
who invited you, and how did you learn about today?
I'm with Black Infant Health, so of course, shout out to y'all. And yeah, I heard through them, so I was excited. I just moved out here probably about 10 months now. So yeah, I'm so excited to have like the community, be a part of the community, and a lot of black people too.
Come on, come on. What a dope
So,
setup, right?
yeah,
We
so
love to be in community.
yes, so I'm excited about it.
I love it. And she want to say something too. You want to say something? Hi.
Hi.
Hi, I love it. We're not shy. So, Mom, have you been pregnant, or tell us about your experience?
So
right now?
I am almost 6 months pregnant. I'm due in December 1st. And yes, I'm having a secret gender reveal, so the baby's still unknown right now.
Wow.
And through the process, it's been a little challenging, I should say. I did go through some health issues in January. Had a miscarriage,
Mm.
so I kind of was like, wasn't sure about this pregnancy. It kind of happened really fast after, and I just was like trying to get this experience to be, something I wanted to enjoy. So
Yes.
every day, having the support group, having, the things that I need to kind of cope through this has been a journey. So I'm excited. Look, I'm
Oh, I love it.
excited. I'm
Thank you.
excited. So yeah,
Yeah, thank you for
yeah.
sharing your story. And it's not easy talking about your miscarriage and the ability to also trust Creator to get pregnant again and move forward and support your family expanding. I'm so glad that you're connected to our partners, Black Infant Health, San Joaquin Public Health. We have something beautiful for you today. We're going to just ask that you pick it because
Oh,
you don't know what you're having yet. I believe there's a gifts for yourself or gifts for the baby,
wait.
but please pick whatever gift that you would love.
Okay. I'm gonna have her do the honors. To give
Okay,
her a part of
baby.
something, and
Yes,
she
I
keep
love
asking for the
that.
mic.
That inclusiveness is real when you bring in a new baby, huh? Come on, y'all.
Yeah.
Come
Yes.
on, mama.
Yes.
Okay, you're gonna pick something. You're gonna pick some. Show me what you're gonna pick. Okay, come
The
on, you
pink
go ahead
color.
and get it. You know that pink is always something.
Which one?
All
All
right,
right.
she picked it.
Ooh,
Look, bring it
okay.
over here to mama.
Bring it to me.
Bring it to mama.
Bring it to me,
And
mama.
you can open it up with mama.
Yes.
Come on, baby. I love it. Show us what you got. It is a baby shower. Show us
Okay.
what you got.
Let's open it. Pull it out.
Oh, you got a journal. I love this.
Oh,
Oh,
this is
little
so
pink tutu.
cute.
And a little, is that a headband?
Yes, so
Oh, that's
cute.
amazing.
Oh, thank
I love
you.
it.
Let's hope it's a girl.
Well, you better manifest it. I love it.
Yeah.
So each one
Nice.
of our mothers, show us your bag that you got. Each one of our mothers, when they walked in, they were greeted, they were loved on. They got a tote bag and also a diaper bag that was sponsored by Health Plan in San Joaquin. And we just want to love on you and tell you we're proud of you,
I
Queen.
appreciate that.
Keep pursuing your dreams and your family, and we're here for you.
No, thank you. This has been a journey. So, like I said, just with the support and seeing this room full of Black people, like I feel so inspired, and I just want to make sure that like I give that to her and both my kids. So I
I love
appreciate the
it.
opportunity to be here.
Thank you,
Thank you.
Queen. Thank
Thank you.
you. I got one more raffle, and then we're going to have our next Power Talk. Please get your raffle tickets out. The number is 002279. 002279. Is that anyone in the audience? 002279. And the name on the bag, thank you, is New Nevea. Nevea, which is heaven backwards for you all that don't know. Nevea O. Okay, is she here? So when Nevaeh gets back, we'll have her gift, and we want to thank you, Sister Erica, our activist, for helping us. And now we're going to move forward with our next speakers. I would like to call to the stage Mr. Imani Lucas and Lashana Brazil, United and Guided Co-Ed Doula Services. All right, as they're coming to the stage and they're getting settled, follow our efforts on Reinvent South Stockton Coalition. Let me tell you, either side is fine. Uh, Follow our efforts on Reinvent South Stockton Coalition. we're coming together with many of our partners here in San Joaquin County, uplifting the voices of our mothers, our babies. And advocates have said we're going to stand together and decrease these maternal rates. They're important for us to make sure that tomorrow is promised to everyone that has a chance, and Black maternal health has a chance to go as far as it can, because a lot of the things that we're seeing are preventable. And so, again, thank you and welcome, 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 welcome.
Good evening.
And so, you traveled all the way from Oakland, California to be with us today.
Yeah, actually, Sacramento.
Sacramento,
Yes.
wonderful. So, tell us about yourself and tell us about the work that you're doing in your community.
Yes. Well, our work began with the spinoff of the Black Infant Health Program. Shout out to Black Infant Health here in Sacramento. It's called the Perinatal Equity Initiative, and they had recruited fathers to develop fatherhood initiatives and fatherhood programs, bringing back fatherhood to birth work. And we were just very pleased when we got the opportunity, because Sacramento gave us a blank slate to really bring together Black men the way we thought we should. So we started a weekly self-care Sunday out in a local park, and we did that to show our county that we did not need much in order to bring Black men together. It's a free public space. Every Sunday we're out there, and the only thing it costs us is consistency. And so we've been out there since COVID, when we were wearing masks and staying 10 feet apart and taking people's temperature. And that eventually led into our work in co-ed doula. We started to look and listen to fathers and realize that there was always these large disparities in communication. Fathers felt disrespected when they would go and speak to people in the social work office, when they would go and speak to people at the hospital. And professionals tend to just tell you what's on their mind without really considering what was in that Black man's mind, which of course is to try to be a better protector, provider, and co-parent.
So, Brother Imani, you said that right on point. We actually had some fathers on our last podcast at our last baby shower, and a lot of them were saying, even our mothers are forgetting the importance of having the father in the home, and that they're just not simply a paycheck. Uh-oh, it's not Andre 3000. Um, and I being a single mother really had to humble myself and listen to that, because I've provided for my children without the essential help of their fathers. And we see that a lot of times in the Black family unit. And I think it was purposely designed in that way, back to slavery, when our fathers were broken and bucked out and sent to many different other nearby plantations to support the growth of their economic development. And I'm gonna say that very lightly. So a lot of those things that we see, the Black family unit go, right? A lot of the racist policies that we've seen, even in child welfare, when we talk about that documentary of the Black welfare queen. Please look it up on YouTube. It's very educational. But it talks about how our mothers had to hide our Black men from the home just to keep cow fresh aid. And listen,
Right.
I don't know what we have to do to mobilize, but some of those policies are creeping back into San Joaquin County. Right now, there is an ordinance that's in San Joaquin County that's being looked at. If you have any amount of drug use, you can be kicked off a child, or you can be kicked off of your CalFresh benefits and also your cash aid.
Yes.
And that's amazing that we're seeing this recidivism of racist policies and implicit bias, because I don't know how many of us in this state of California that smoke marijuana, but that's considered a drug.
Yes. and a very easy way to trap somebody and get them into the system. And really, it's the systemic issues that are part of the cause of the largest disparities. Because there is a lack of communication on both ends, it's not just the healthcare system. Of course, it's our legal system, our judicial system. You know, we used to whip and chain our black men. Now we just beat them up in court. It's really easy. And, you know, it's so easy that an accusation is good enough. Accusation is as good as proof in some of those courts. And so we provide some services that could potentially help that. One is our career development services, where we're trying to work with fathers and get them trained in community health work, doula care, and mental health peer support. The reason why we chose those are three services that are billable by Medi-Cal. And I'm proud to say that United and Guided had just been approved by the Department of Health Care Services to be a Medi-Cal provider. But it's not just about the fathers. We brought on Miss Lashanya to actually really show us the medical side of the doula care and the motherhood side of the doula care. So now when we're out there doing our self-care work, it's about both parents. And, we have that on our little shirts, peer support for parents. And that's how we move forward.
I love that. I love that. You know your stuff and you spit it. Listen, you got to be the advocate. When you go out here, you better know your stuff. And moving on to Sister Lashana here. I want to know,
Good afternoon.
come on. So you're a certified doula.
I am. I'm a certified doula, an elite care manager, a mommy of 5 grown adults, grandson, baby, and whatever I have to wear in my community. Thank you. But it's just like Mr. Lucas said, going back to the fathers that we serve in our community. I had a father the other day, brand new dad. They're several months pregnant, and his question was, he had questions about the milk. How is the storage and the care for the milk? So, of course, I'm an expert that I know, but what I said was, let's look this up together. Let's do this education together. And my thinking behind that is because he can share that with someone else. And then his other fear is holding his baby. How do I hold my baby? So a strategy for that we have the next time we see him, and over the next few sessions we see Dad, he's going to hold a little one of those lifelike dolls. He's going to hold that baby during our session, so those fears are overcome.
Yes.
So we try to make sure that we're listening, because we are experts and we know our stuff. We have our lived experience, but it's not our experience doing that birth for that family, right? That is totally their experience. So try to make sure we're listening to both mom and dad, and you get a dad doula and you get a dad
Come
doula,
on.
you know, both. And so that it has worked. So far we had like 15 successful births.
Yes,
So
Wow, congratulations.
And 6 black male doulas, which is amazing.
There you go. Yes.
Come on, heart it up for our streaming family. Listen, what are some of the issues you're running into? We don't trust the system. Let's talk about it. We don't trust when they tell us things.
Right.
I advocate, and I know a lot of my colleagues are tired of me beating that dead horse, but I try to remind them, be gentle, practice cultural humility, right? Practice the ability to activate your ears and listen to every mommy and daddy that comes in there. So what are you up against when you're in this work, when we're trying to destigmatize, when we're trying to deconstruct that ability to actually trust somebody?
You know, it's not so much from what you guys are. Well, I was born and raised in Stockton, class of '93. Let me first
Come
say that.
on, let's go. All right. What high school? What high school?
Edison High, baby.
And,
Like,
house, let's go. We got a soul bike. We got a soul bike.
Right.
Yeah.
So it's not much. It's not different from what you all are. We're experiencing down here in San Juan King County. The same disparities, the same issues. The inclusive, not including the father, homeless, lack of education. We know that our mothers, as you stated, are dying at a higher rate than anyone else. Not because we don't want the care, but the resources are not available to us, right? We don't have the knowledge and navigation, or no one advocating for us. So
and I would just add that, the system is everywhere. It's not just the police and the court system, but it's in our government jobs, 9 to 5. After 5, how much are you really thinking about the social causes that you're working on all day? So when you are working in a system like that, right, where it's very regimented, you can totally cut your mentality off when most of what's happening with our community is happening after 5. So just the way we have our work systematized is a bit problematic, right? But when it comes to the legal systems, we try to interrupt that by providing those services to avoid costly litigation. For example, our conflict mediation, which is working real well with parents, because not every set of parents are going to be a couple after the pregnancy or even during. So our goal is to just make sure that dad can be a part of the birth process and allow that man to be the quarterback of running, of really operating around with the family members, the hospital staff, to try to relieve as much of that stress from the mother as possible. All she should worry about is the childbirth. But when there's everybody else, there's other people that want to be a part of that pregnancy, that dad could be the quarterback for that.
And I love that. And you're modeling that, right, for dad. And are you going through exercises with dad, coaching dad? Do you have any parental classes like that that dads can enroll in?
Yeah, right now we are starting our workforce development project because we got qualified to provide Medi-Cal services. One of those is community support. So for our doula clients, if a mom and dad comes in, we are actually able to help them with job training, particularly if they're on cash aid. We're able to provide some training for 6 months. It's a paid training. And again, we'll be training in community health work, mental health peer support, and doula care. So we've gotten our doula dads just from going through that type of training. But then they're off. If after that 6 months they decide that community work may not be for them, they can still take those skills and move on to wherever they'd like to move on to.
I love that. I love that. And we're doing that through CalAIM right now,
Yes, ma'am.
through Medi-Cal. And if you don't know what CalAIM is, you do have the ability to get a provider, a doula, a CHW. You can ask your provider to help you with that and assist with that. So
Yes.
I ask you again, even with some of the issues, what are some of the issues you're seeing as a doula when you are going into the hospitals and you're uplifting your clients' voices? What is one of the, let's just say, number one thing you keep seeing that we may need to keep an eye on or maybe advocate more for?
honestly, when I'm in the room with them, it's just the mother or the father not being listened to. And so we have a strategic way of making sure we don't have to become belligerent and the bad people in the room. But there's only three rules when you're practicing being a doula. When you're in that room, it's support, support, support. That's the only three things you need to know. So we keep that in mind. But the strategic way we do it as an organization and as our co-ed doula team, we put that birthing plan in place. That contract is there. The contract is there because again, it is the parents' experience. So whatever the mom and dad wants during that pregnancy, that's exactly what's going to be acted out, and then it is given to the providers prior to the birth, so everybody is on the same page. That way we won't have any challenges. Have we run into challenges? Absolutely. But we kindly just say, hey, there's a birth plan in place, could you please refer to that, so we can focus our energy on mom and dad and what and that baby that's soon to come and be born healthy.
I love it. I love it. Thank you so much. I appreciate all your advocacy. I think it's wonderful that you're encouraging our men to be present, to be mindful, teaching them kindness, teaching them gentleness, and teaching them how to advocate more than ever for themselves, being able to model and be there for them. Please, please plug yourself. We have our community that's watching here and also listening in on Spotify. So please tell us where we can find you and how we can support your work.
Yes, well, we are out of Sacramento, 3810 Broadway. We are available through telehealth services as well. So if you'd like the co-ed doula experience, which is rather newer to the Black infant health perinatal equity space, please contact us, www.unitedandguided.org. Right there on the first page, you'll see a little video about an act of kindness that we want with Dignity Health. But right under that is where you can schedule an appointment to meet with any of us, either virtually or in person.
I love it. Thank you so much for coming.
Thanks for having us.
Yes. And so, as we're waiting for our next, we're going to have Dr. Lakashmi from Health Planet San Joaquin come up and be our next power speaker. But please, after these announcements, tune in. We'll be right back. Give us 5 minutes. Huddle Co and Create, and we're here at our How Do I community conversation. And listen, I have to my left right here my beautiful activist Tamisha Turner. Let's go. We're going to be hearing from Tamisha a little bit later, but we had a baby shower, so we got some gifts, don't we?
Yes,
All right,
ma'am,
sis.
we sure do.
All right, why don't you go ahead and call that number out?
All right. So I actually got some numbers and names. So just in case if you don't hear your number, so we have 002274.
002274. Is that
Zero,
anybody in
zero.
the audience?
2274.
Okay,
Shall we share
okay.
that first name?
All right, let's shout out to this first name, Brenda. Is Brenda in the building? All right, Brenda. Our activist, can you let Brenda Andrade know outside in our lobby area? We have a lot of our individuals still talking to our community resources. We have Black Women for Wellness here. We have Reinvent South Stockton Coalition here. Trade Women Union is here because mommies need to work, and we need to be unionized to prioritize our family members. Let's shout out to that other number.
All right, we have 002262. 002262, and that would be Miss Audrey.
All right, Miss Audrey. Let's go. Oh, I want Miss Audrey to come on up. She's looking beautiful.
That's okay.
Okay, come on, Miss Audrey. And it's
Audrey.
Trees. Come on up here. You looking beautiful. I always want our family members to, and you got one of my best shirts on. You know that? You know that? I love Mandalorian. I'm a big Star Wars fan and I'm a big Marvel fan. But you looking great, mommy. I don't even know why you was shy. Your eyelashes is on, girl. You got that good, beautiful face. It's wonderful. Your skin is glowing when you're pregnant, huh?
Yeah,
So
finally.
finally, so tell me, how many months are you, and is this your first one?
I made 8 months today,
8 months today. All right, mommy.
and this is my fifth baby.
This is your fifth baby. Congratulations, mommy.
Thank
You are a blessing. Your legacy is coming for you. It's going to come through your children.
you.
And so, as a mommy who actually knows how to be a mommy, what can you tell some of our first expecting mommies to expect? Whether it's to advocate for yourself or whether it's to speak up. And let me slow down a bit because I'm being disrespectful. Is this mommy or sister?
Mom.
Uh-oh, we got the second generation in the house. Okay, what's your name?
Stacy.
Oh, look at Stacy grab that mic like I am not shy. Listen, I love it, Stacy. And you all are from this area, Stockton?
Actually, no, we're from the Bay, and about 13 years ago, right before she had the first grandchild, we moved out here, and so she's had all the babies here in San Joaquin County.
Wow,
She's had
wow.
some good experiences and some bad.
She has some good and some bad. I need y'all to talk into this mic because our family that's streaming need to hear what y'all have to say. And don't be shy because your testimony can save somebody, your advocacy can save somebody and help somebody. So when you're talking about your experiences and being a mommy, um, of course you have your support here with mom, and you're here today. Who invited you here?
Black Infant Health.
All right, Black Infant Health. Let's go. Getting connected and staying connected. And so you've been here 13 years. You're a Stocktonian now. I'm sorry. I know you're shaking your head, but we need good people who come into this community to stay and support and love this community because we need to grow this community with our experiences. So I want to hear about yours really quickly. You were saying you had some bad and you had some good.
Yeah, for the most part, the bad was just doctors not listening. Like,
Yeah.
even just going through pain, they assume that you want meds or whatever. Like, and I'm not used to meds and stuff, and they'll just ignore it.
So just ignoring your pain management. And were you ever connected to a CHW or a doula?
No, this was the first time.
This your first time being connected to a doula out of 5 pregnancies.
First time I've got this much help at all.
Wow. Wow. Come on. We can clap it up. We're changing the narrative. We're changing the narrative. And so, do you know that we have a community lactation room, especially for mothers like you upstairs?
No.
It's free of charge. You can connect with doulas, you can connect with CHWs, and it was provided and supported by Health Plan of San Joaquin. And they're coming up now after you. But I want you to pay attention to their speaker and what you can do to advocate for your pregnancy now that you may have not advocated for your last pregnancies. And I want to tell you, thank you, Queen. Thank you for coming up here, Queen, supporting us. We have a gift, and I want you to go on ahead and, pick whatever gift that really jumps out to you and want to make sure that you're loved on in the best way.
So many choices. Right. I'll do that one.
Okay. So the beautiful backpacks, and we gotta looks like you gotta open that up real quickly there and see what you got. All right, we got a family game, Monopoly.
My kids would be happy.
I love it. What else do you have? Okay, so you have some information, a book bag, some pencils. Okay, and then you also got some bags and Okay, you're ready. And this is the Achievement Award. Okay. Oh, and it looks like it's an Achievement Award and it's a gift card to have it. That's wonderful. I love it. She loved that. We love to have it. Thank you so much for coming and joining us today. Please get connected and stay connected with one of our CHWs. Make sure you tour the community lactation room whenever you're downtown and you need somewhere to breastfeed. Just come get some support or connectedness. Use our lactation room. It is open 7 days a week. You can come in here anytime you need to. And reach out to us at rssccoalition.org. Miss Kimberly is in the back. Our activists are also connected at Flourishing Families when you need them.
Okay.
Thank you.
Thank you.
We're so happy. We are moving towards our ability to get everyone together and get everyone activated here. As we enjoy our next speaker, I want you to know that we are moving towards equitable opportunities and also sustainability in Medi-Cal. Medi-Cal is changing. It's one of the best um, abilities of medical coverage that you can have. And so our next guest is a beautiful person. I've known her for these last year, and I've worked closely with her in Black maternal health and finding strategies to support us. I'm going to ask Dr. Lakashmi to join me on stage. You can heart it up, clap it up. Dr. Lakashmi, you look so beautiful. You always look elegant. Thank you for joining us today.
Thank you. It's such a pleasure for me to represent the health plan of San Joaquin and to join you here today.
Thank you so much. And we're going to be asking a series of questions, but before we do, we like receipts over here. Dr. Lakashmi joined the health plan of San Joaquin as Chief Medical Officer in 2013 and brought to the world extensive experiences in directing and coordinating utilization management, case management, health and disease management, pharmacy, clinical analytics, and quality improvement programs to ensure delivery of cost effective, quality health care. Dr. Lakashmi has significant experience in managing the complex issues of members with state funded insurance programs such as Medicaid and SCHIP programs. She volunteers in various community efforts here in local community. She serves on the Community Health Fund Community Committee of the Community Foundation of San Joaquin. She chairs the Community Partnership Advisory Council of Health Careers Academy. Welcome again. Let's get right into it. I love it. I love it. I know you got your notes because you stay ready. And I love that about you. When we're talking about our community conversations, and we're talking about what's happening in breastfeeding right now and some of the things that we need to keep our eye on if we're really going to advocate. Let's talk about these breastfeeding disparities. We know that fewer Black infants are breastfed, right? Tell us about that.
There's just about 74% of Black infants are breastfed when compared to 80 and 90% of others that are breastfed. Asians, it's 92.7%. If you take the whites, it's 86.2%. And Hispanic, it's 83.4%. So why is there this disparity? So it's not just that it's in the Black community, it's also the socio-economic factors. If you take our region and if you take Stockton and South Stockton especially, there are certain zip codes where people are so challenged. And breastfeeding, as much as we say is the best thing, it's also not just easy. It doesn't happen automatically. You need a lot of support. You need a lot of care for the mom and support for the mom. I think that's what's missing. And I'm really proud to see the good work that you're doing, your organization, and several others here, including Black Infant Health, to bring that care, to bring that extra support that moms need, especially Black moms, in order to support the breastfeeding.
Thank you so much for acknowledging that. I appreciate you. A lot of us are not as educated as we need to be. I don't know when black breastfeeding went out, but I know that canned milk is not set up in my paycheck, okay? And I presume to always try to breastfeed, but I know sometimes it's hard. It's hard on our mothers economically, especially when we have to work two jobs, extra side jobs, and being able to bond and hold our babies to give them that nutritional human milk, right? The human milk is essential.
Absolutely, absolutely. What you said about having two jobs, I think as a community, we need to respect the fact that anyone, all women, should be able to respectfully breastfeed at any place, at any time.
Shay, come on, clap it up.
So that's what we need to do as a community. We have to have breast friendly healthcare settings. We have to have breast friendly workplaces. And we as a community need to support everyone, every woman to be able to breastfeed as much as
As
possible.
much as possible. I notice here infants eligible for or receiving WIC are less likely to be breastfed. It does highlight income disparities. 75.4% of children receiving WIC say that they are breastfeeding, and 92.4 of children ineligible for WIC are also breastfeeding. So we're seeing a lot of that economic disparities. So why should we breastfeed? As an advocate, we're going to be going through this and sharing. Uh, you know, what does breastfeeding do for your baby?
So, first and foremost, I think many of you touched upon this point earlier, the baby bonding, the bonding between the mom and the baby. That is what breastfeeding really promotes. In addition to that, this is this is the best thing for the baby in the sense that it's clean and easy to breastfeed. And a lot of infections are warded off through breastfeeding because there are antibodies in the mom's breast milk that really protect the baby from getting ear infections, getting lung infections, and gut infections. So that's the big that's some of the good things. Other than that, there is also the infants are less likely to be obese or overweight when they are
Nice.
breastfed.
Even though I like chubby babies,
Yes.
that's one of my things. I'm like, give me that chubby baby.
Yeah.
Right,
But to be healthy, you don't have to be chubby.
right.
And breastfed infants are really healthy. They are healthier. And in terms of cognitive development too, breastfeeding helps. So the intelligence tests, breastfed babies seem to do better on intelligence
Wow.
tests.
Wow. And so when we talk about improving our baby's digestive system, I know there's a lot of MGOs. I know it's a lot of additives that are to the foods that we eat, mommies, that come out in our breast milk, that also can come into the baby's breast milk as well. So, how does the breast milk heal the digestive tract system?
So I think it's easy to digest compared to like the formula fed babies. Breast milk is a lot easier on the gut. So I think that's why it's important for gut health, and it also stimulates the natural environment in the gut to improve so that the babies can digest the other foods as they grow up.
I love that. And I know a lot of babies, they have colic. Sometimes that has to do with your GI tract of the baby, and sometimes the baby can't digest, and you'll see the baby crying a lot. But we don't really know what really brings colic on. But a lot of times we see that it's after feedings and it's tummy issues. And so that can be frustrating to a new mommy to have a baby that's always crying. And so that's supporting that. I think I want to speak about what's nursing do for mothers? We see that. I know that they always told us after you have your baby, especially after my cesarean, I was I didn't like that fufa. I tried to tell the surgeon, can I get a tummy tuck while you're down there? Listen, somebody. But I was trying to make sure that after my second baby, my tummy had went down. Right. Tell us what it does to the womb health.
Yeah, it's not just for the baby, it's for the mom too.
Mm-hmm.
Breastfeeding really helps the mom. Early on, it helps the womb contract. So
Mm.
that way, like the bleeding and all the side effects that you have after the baby is born, that's much better with breastfeeding.
Mm.
And it's so convenient. You don't have to get up and fix the bottle. Breastfeeding is convenient. It saves a lot of time.
Just pull that tata out. Come on, somebody.
Absolutely. And then it reduces the risk of breast cancer and ovarian cancer. I heard one of the speakers earlier talk about the risk of ovarian cancer in black women. So the
Yes.
incidence of cancer, both breast cancer and ovarian cancer, is much higher among black women. So we really need to promote breastfeeding among black women. So I'm happy to see that all of you are supporting through doulas and CHWs. You're promoting breastfeeding and supporting the moms in order to continue breastfeeding. So that's extremely important. And all of us, every one of us wants to lose weight after we have the baby. And breastfeeding is one of the ways in which you can do that.
Mm-hmm. Mm-hmm. And so a lot of times too, we're looking at the breastfeeding support. And I have Kaiser, but when I went on disability, my income dropped. And a lot of you know about that. When you go on disability, you're earning 65% of that money coming back unless you got AFLAC. And that wasn't a promo for AFLAC because they give you that supplemental insurance and it helps. But the benefits of having a breast pump. Now, I understood that our managed Medi-Cal will prescribe you a breast pump. How do we advocate for that?
Absolutely. At the health plan of San Joaquin, we definitely will. It's a benefit to get a breast pump, and we'll support the mom by providing the breast pump, and they can get an electric breast pump. The ones where the double breast pumps
Right.
are available. Your doctor has to just prescribe that, and there's prior authorization required. And if there are complications, if there are medical needs, we also provide the hospital grade breast pump. So if you
Nice.
have a premature baby, your baby's in the hospital, if you yourself have to stay in the hospital, or if there are other medical conditions, then your doctor can prescribe for you to have the hospital grade breast pump, and that's available as well through the health plan of San Joaquin.
So all we have to do is ask our doctors.
Yes, ask your doctors and let them know that it's a benefit through the health plan. We make them aware of that. We make all the doctors aware of that. So you just have to ask.
I love it. I love it. And so we're also always talking about upstreaming support. Our community really relies on the health plan in San Joaquin. The dollars that you put aside that support these type of events, advocacy, campaigns to increase our measures of health. Tell us about that. Tell us how you upstream support.
Absolutely. We know very well that as a health plan, we cannot achieve all the things that we want to unless we partner with the community. And I think that's a differentiator with our health plan, the work that we do with our community. We have great team members that are always out there in the community looking for such partnerships. So we are proud partners of community events such as these baby showers. We're very proud to partner with you. We host events such as the Black Infant Health events. We actively participate in the Perinatal Health Equity Collaborative. We are a long-time partner and host of the Breastfeeding Coalition as well. So these are some of the examples of ways in which we partner with community organizations that are key to helping our community.
Ashe. And so if we're wanting, and I know I have my connections with Health Plan already, but if there is a community-based organization or a church or a women's group or any other group that is interested in partnering or getting support from Health Plan, how do they go about that?
So right now, if you go to our website, we are, advocating for you to apply for various grants. The Health Plan of San Joaquin is committing $100 million over 3 years.
Come on, y'all, clap it up. She said $100 million for 3 years. And I want you to speak into your mic because
Yes.
your voice is soft and we need to hear what you're saying. It's important.
Okay. The Health Plan of San Joaquin has committed $100 million over 3 years for community reinvestment. So if you go to our website, you can look at the various grant opportunities that are available. So please do check, and if any programs or plans that you have really are eligible for those grants, we want you to apply. We want you to take advantage of it. The more we help the community, I think that's when our members will thrive.
Ashe, thank you, Queen. I appreciate you so much for being here today. If you have any closing remarks, this will be the great time to share it with us.
I just want to say thank you so much for letting us be part of the community, and for working with us to bring the best care for our members. We couldn't do it without all our community partners. So thank you to all of you.
Ashe, thank you. Let's clap it up for Dr. Lakashmi. She came all this way to be with us today. And it's important that we support our community members. We get the word out. Medi-Cal and Medicaid is some of the best essential insurance out there. Please take advantage of it. Go get your pap smears. Go get your breast exams. Go get your yearly checkups because it's important to preventive health and open your mouths and advocate more than ever because people are listening. It's important in this moment in time that we together stand to decrease the maternal and morbidity rates in San Joaquin County. Thank you.
Thank you so much.
Next up, we have our next speaker. And before we go to our next speaker, we're going to ask that we take a 5 minute break. What's up, y'all? We are back here, coming live, streaming live here from Huddle Co and Create at our third baby shower. And I am so excited to be coming live on the Prune Tree podcast. This is my personal podcast that I talk about the growth of the person and the self reflection. I want to give a beautiful shout out to our muralist for this piece, and I don't know what they call this piece, but it's a beautiful piece. And one of my good friends that came in yesterday to see the setup as we were setting up said, "This is simply Ashe. Ashe, giving that breath, giving that life, understanding your assignment. And as we're working towards Black maternal health, I have my lactivist here and also our senior project health equity coordinator of Reinvent South Stockton Coalition, Kimberly Robinson. Heart it up, y'all. Let's go.
Yay. I'm honored to be here. Thank you.
Thank you. And so, can you briefly tell us just a little bit about the work that Reinvent South Stockton Coalition through our Black Birth Equity Initiative and what we're pursuing right now?
So, right now, we have a lot going on. This, as you mentioned, is our third community baby shower. And we have one more that is coming up in October, October 19th. And that one we are uplifting the voices of the Tias and the TTs. And so it's a Tia and TT's Tea Party. Say that.
Love it.
Say
Tia's
that.
and TT's Tea Party. You got to say that really fast.
Right, right.
Yeah.
And the reason why we're doing it is because I'm sure, you can think back in your life and think about someone, may not even be a blood relative, but there was a Tia in your life or a TT in your life that helped you through your journey. And so we want to uplift that voice. We also, as we're talking today about the importance of breastfeeding and uplifting it, especially in the African American community, we also have our lactation room that we have here at the Huddle co-work space. And in our lactation room, we have CHWs and doulas that will be working out of that space, as well as lactation consultants, which two of our partners will be on the podcast later on this evening. And our biggest thing that we're doing right now is focusing on the high infant and maternal mortality rates in San Joaquin County. And we're doing that through a strategic planning process. And so we have invited the local hospitals, local organizations, and also the community, because we're going to be doing some community listening sessions. And so we want to get to the root cause of why San Joaquin County has such high rates and uplift, what's happening in our communities. And also in partnership to that, we're also doing some policy work as well. And so that's what we have going on right now. We really want the community to come out and be engaged, because we need to hear what's happening from the community members and uplift your voices. So thank you.
Thank you for always advocating for us. We appreciate you. We're going to call some numbers because this is a baby shower. And I'm going to call some numbers and I'm going to ask that those that are still left over here, that we're going to do some raffle prizes. And if they're here, we'll ask them to come to the stage. I have a Fabian Rodriguez, a Nicole Kraft, and a Kia Edwards. Are they still in the building? Fabian Rodriguez, Nakia Kraft, Nicole Kraft, and a Kia Edwards. Okay. So I think they might have stepped out. We have community resources here. Kim, I did state a couple of our community resources a little bit earlier in the podcast, but can you tell us who's all here today?
Yes, yes. So we have Catholic Charities who was here, as well as Black Infant Health was here. We had the Department of Health Care Services that were here. Tradewinds Women was here. Black Women for Wellness, as well as RSSC. Lots of community organizations that participated in our event today, and so thank you all for being here and showcasing your services.
Thank you so much. And look for our event, our next baby shower. That's
October 19th.
October 19th, and you can find that on our social media platform. Please subscribe to our newsletter. You can write us an email at info@rsscoalition.org. Also, you can visit our website at www.rsscoalition.org. Thank you so much, Kimberly.
Thank you.
So, as we're moving on to our next guest, we're excited because San Joaquin is on fire. We understood the assignment. We're here navigating these disparities, and we are wondering and watching and asking the questions: how do we decrease the maternal outcomes? Um, Coming to us now is Adrian McIntyre. Come on, Adrian. Let's give it up for Adrian. Now, Adrian, you come from San Joaquin General Hospital.
I do.
Okay, I think I have your bio here. If you'll let me just read that for a moment, I want to make sure that I give everybody their just due and also let everyone know who's here in our community serving us. So, Adrian, Dr. Adrian McIntyre, is an advanced practice nurse and birth equity advocate committed to improving the health outcomes of families. With over 20 years of experience, she is passionate about elevating nursing practice and recently completed her doctorate of nursing practice degree at the University of California, San Francisco. Congratulations, Queen!
Thank you.
I love that. Adrian has successfully directed nursing, clinical practice, quality, and patient safety and care delivery for a multi hospital network in Northern California and is now the Deputy Director of Nursing for Women and Children's Services of San Joaquin General Hospital. Outside the hospital setting, Adrian serves as a council member for the California Maternity Quality Care Collaborative Perinatal Equity Advisory Council, as a nurse ambassador for the necrotizing. Did I say that right?
Necrotizing. Yes.
Okay, and you got to say the next word for me.
Enterocolitis.
Intercolitis Society, an organization dedicated to eliminating newborn gut disease and promoting the benefits of human milk diets in infancy, and as active member of her church, the Well Christian Community. Welcome, Adrian.
Thank you.
I
Thank
thank
you
you
for
so
having me.
much. I thank you for staying around. We have had dynamic a time here today connecting with our community and our advocates. So, what brings you here? Tell us a little bit more about your work.
Absolutely. So currently, I'm serving as the Deputy Director of Nursing for Maternal Child Health Services at San Joaquin General Hospital. I've recently transitioned to this role. I'm 90 days in.
Okay, you got
I'm
this.
new. I'm new to the role, and it was important to me upon taking this role to really get grounded and established and connected within the community. And that's really why I'm here. I've already taken so many notes listening to the panelists and listening to those walking around, those that are pregnant and planning to deliver, really wanting to hear from our community about how San Joaquin General Hospital can rise to the occasion.
Ooh, I love that, Queen. Listen, we got another queen putting their money where their mouth is. So that patient advocacy is important. Those lived experiences and actually uplifting the voices of some of our most disenfranchised or vulnerable populations. What are you doing now? What strategies that you hope to implement in San Joaquin County and in General Hospital?
Absolutely. So San Joaquin General Hospital is on a birth equity journey. We are participants of a state collaborative in which we're really digging into healthcare bias. I heard it coming up earlier. We're really looking at our healthcare providers, physicians, midwives, nurses, and we're asking ourselves the question, what am I bringing to work every day? How am I looking at our patient population and potentially exacerbating stigma in the healthcare setting. So we're really leaning into that. We're on a journey. We have partnerships with various community health organizations like Delta Health Center, where we're inviting them in and helping to bring the voice of the patient back into the hospital.
I love that. And slowing that down for a little bit, right? We're talking about also the decision making during that time. That decision making, being a medical social worker, sometimes advocating for my patients and seeing it from the eye of a social worker versus the eye of a practitioner. And sometimes that can be difficult in the continuum of care. What are you doing to strategize that entire care? When that woman comes through your doors, it is the same and it's consistent and it's equitable for every mother.
It's a combination of things. So, first, it's examining our practices, ensuring that they are to the higher standard, that we are really subscribing to evidence based practices, bringing in the tools, the equipment, and the resources that are needed to care for our patient populations. It's leaning into bias, like I was saying. We want to look and address microaggressions that are occurring in the hospital setting.
What? Come on, y'all.
Yes, we're doing some deep work.
Them euphemisms is real.
Yes, we don't want to be implying anything about anyone. We want to be actively listening at the bedside. And then we're moving away in healthcare from informed decision making to shared decision making.
Ooh, tell us the difference, Queen.
The difference is, historically, all of the power, the information really resided in the provider. I know everything and I'm here to inform you so that way then you can make a decision that truthfully aligns most likely with my values and the way that I see healthcare progressing. And really what we're trying to do is empower our clinical providers, be it nurses, physicians, midwives. You need to be actively listening. You need to be connecting with your patients in a way where you understand their values, what's important to them, what does health and quality mean to them. And that way, when you're presenting the various options, those patients are sharing in that decision making in a way that reduces trauma, reduces the stigma, and allows them to feel empowered through their healthcare experience.
Listen, I just got vibes all over me. I mean, the old folks at the church say, I felt the spirit. Listen, somebody gets it. And I think that's why we need those with lived experience, those that have the cultural competency to also be in leadership. It's been a while since we had someone that looked like you,
It's true.
understood the truth of what it means to be Black, right? And to practice in San Joaquin County. So that tells me right there that we're making strides.
We're trying. We're trying. I heard earlier, when Congressman Josh Harder was here, he was really talking about connecting with the community in such a way that our healthcare workers, they look like us.
Okay.
And San Joaquin General Hospital participates in a program with Delta College to help grow our nursing workforce. It's called the HOPE program.
Yes.
We participate as well as St. Joseph's. I want to give them their props as well.
Yes.
But the whole intention is to take those that are currently invested in working in the hospital setting in various jobs and disciplines and helping them to navigate nursing school and to become active members of our healthcare workforce.
Definitely.
So we're supporting them through tuition. We're supporting them through time.
Oh, I love it.
The hardest thing to get sometimes is time.
Mhm.
And also allowing them to secure employment both through their schooling and then afterwards. And so it's an amazing program.
That's amazing. And shout out to Dr. Anitra West. That is our lady in good standing, always coming through for this initiative. When we talk about these specific programs, how are we outreaching? How are we getting the word out? And how are we increasing those enrollment numbers? What do you need from us? What do you need from our community?
I think a lot of what we need from the community is, we have to be real. A lot of programs, particularly nursing programs, they're centered around standardized testing, and there's still quite a bit of stigma in the way that standardized testing is constructed. And so we do have to inform, educate, and prepare those that want to go into these programs on how to approach standardized testing. So it really does start in the educational system. But moving on from there, most people need a sponsor. And I'm here to say that I am willing to sponsor anyone that wants to pursue the nursing profession. I have sponsored individuals in the past because a lot of it is seeing, talking, and hearing from someone, again, who looks like you, who's done it, and is willing to help you navigate the course ahead of you.
It makes sense to work it in that way. I want to talk about this, a couple of these councils that you're on, collaboratives that you're on. I want you to say that name again that you're an ambassador of. I don't want to make it difficult, but please tell us about that.
Absolutely. So, one of the outcomes that impacts the Black community is actually premature or preterm birth.
Mm.
And one of the negative outcomes of premature birth at times can be a disease called necrotizing enterocolitis. It is literally an infection that occurs in the gut. And if you are born less than 31 weeks, you are more susceptible to this particular disease. But what we do know is that the science of human milk, so lactation, human milk, what it does is it actually helps to protect the gut by lining what we call the microvilli. I know I'm a science nerd, but it really does. It coats and protects the gut in such a way that only a mother can provide.
Mm.
There is no medicine that can outwork human breast milk.
Come on.
And there are specific bacteria that women can pass while breastfeeding that is only contained in breast milk. It's scientific. And it can help reduce and prevent the negative impact of this gut disease, which can be deadly. So for our small babies, like I said, we have a high preterm birth rate in the Black population, often greater than 30% of the births result in a preterm birth and require stay in the NICU. And so informing, educating, and supporting our mamas who have babies that end up in the NICU is so important. Getting them to start lactating as early as possible and getting that breast milk to their baby, it can prevent diseases like necrotizing enterocolitis.
Thank you for that. Now, at San Joaquin General Hospital, I know you all are welcoming of anyone that wants to have their baby, but do you cater to managed Medi-Cal patients? So tell us about that and tell us, how are you destigmatizing the ability to use the general hospital for your birth? You all have a beautiful delivery room over there, and the floor is wonderful, it's kept clean. Tell us, how are you destigmatizing that?
It's real. The stigma of going to the general hospital is something that I'm very much aware of, and the stigma of the county hospital
Right.
at that. But I'm very proud to say San Joaquin General Hospital, built in 1857, it's been here a long time. But we're one of only 21 public hospitals left in California. So it's really important. It's a cornerstone of our community. Greater than 95% of those delivering or having births in our hospital benefit from Medi-Cal or managed Medi-Cal programs. And so it's very, very important that our patients know that when they come to the county hospital, it's not a last resort.
Okay.
We have extremely high quality. We're leading the state when it comes to reducing primary C-sections.
All right.
Particularly in women of color, Black women. And so we are really leaning into those initiatives that are going to help prevent maternal mortality and morbidity.
I love it. I love it. And being an advocate, I know it's sometimes hard to break away from some of the practices that are even being taught at the root when you go into education. And I've had nursing friends that said, we have books that we read that really don't support the equitable interests of people that don't really look like the books that are being written by the people, if you know what I mean. How are you educating newer nurses coming in? I know San Joaquin General Hospital is a practice hospital, right? It's a resident hospital.
It is.
Okay. And so, how are you teaching our new generation of our workforce development to go against some of those systemic issues that we see in education?
Absolutely. So, San Joaquin General, like all hospitals that are providing birthing services in the state of California, we are required to provide education around implicit bias. It's Senate Bill 464. And I have to say, I'm very proud of our state because we've been expanding Senate Bill 464. So initially, when it was released, the implicit bias training and education really focused on nursing. Why they picked nursing, I don't know, but they did. But I'm proud to say that now in its second and third year, and we are doing ongoing education and training related to reducing stigma, reducing implicit bias, addressing microaggressions, promoting shared decision making, and it's expanded to include physicians. I'm also proud to say that there are advocacy groups, including some of the ones that are here today, that are really seeking to even leverage penalties against clinicians and providers who fail to complete the necessary education and training.
Nice.
So our state is really pushing the envelope with regards to addressing implicit bias in the birthing population, and San Joaquin General is all for it.
I love this. Come on, y'all. Y'all can clap it up. Super excited to hear about that, especially as a social worker and a social justice advocate here. I truly believe sometime our decision making, as much as we may be unconscious about it, can be in that implicit bias. And we have to watch that as service providers. I'm very glad that you were able to come and be with us and share what San Joaquin General Hospital is doing for our community. Like you said, it's been over 100 and how many years now?
I don't know. I can't
It was
even do the
19. You
math.
said it was
1857.
1857.
So we've been here, what, 175 years?
Ooh.
And we're not going anywhere. That hospital intends to be a pillar of the community. And so, like I said, my intention is to partner with community advocacy groups because I want to hear from our patients.
I love it.
You know, we were talking about the stigma of coming to the county hospital.
Yes.
I need to hear what that is. I
Okay.
need to hear the stigmas. I need to hear about the experiences because the only way we can be better is to hear those things. It's
Ashe.
tough to hear, it's hard to hear, but we want to know because we want to do better.
So the dialogue must go on. And so tell us, how do we find you to tell you those experiences?
Absolutely, absolutely. So I can be reached through the hospital operator at San Joaquin General Hospital. I'm open to email. You can email me, amcIntyre@sjgh.org. I will take it. I have no problems with that. You can also find me on LinkedIn. So if you are on social media platforms, you can also reach me through LinkedIn.
You've heard it right here. Service providers, individuals that are advocating, CHWs. When you want to get LinkedIn or connected, please find those that are advocating, those that are specialists, and those that are pursuing the justice that we need for our most vulnerable populations. Thank you so much, Queen. I appreciate you, Doctor, for being here, and congratulations again on your doctorate.
Thank you so much. I
You're
appreciate
welcome.
it.
Next, we're going to be moving on in the program. We have a couple of our advocates here that work here in this beautiful establishment of co-working space. And I would love to just bring up, they're very close friends of mine, and I've been able to celebrate their grand opening this year. And it's been important. It's been important to uplift them and see them grow together. I would like to call to the stage Tamisha Turner, co-founder of Flourishing Families Incorporated, and also Miss Erica Williams, co-founder of Flourishing Families Incorporated. Let's go. Y'all can clap it up. Thank you so much, Doctor. And I don't know if you're going to be, Doctor, I don't know if you're going to be leaving soon, but I would love to take a picture with you. Thank you so much. You two, you have made it through the flame, the fire. Listen, I'm getting your bios together. I should be a little bit better at this as we're dwindling down. We've been on air for about 3 hours now, and sometimes my brain goes foggy, but I'm here.
You're good. You're good.
I'm here. So, excuse me, Sister Erica. Let me reintroduce you. is Erica Dorsey, MED, CLEC, co-founder of Flourishing Families. Erica is a proud fourth generation former breastfeeding mother of three, has a deep desire to listen to and find solutions to increase breastfeeding rates for Black women and other vulnerable populations. She is also committed to amplifying the voices and the stories of Black women to both advocate for and inform local policies to ultimately foster improved maternal and child health outcomes and build stronger, holistically supported families. As a maternal and infant health consultant and strategist, she has contracted with organizations such as California Breastfeeding Coalition to curate an educational news and advocacy content through the coalition's social media platforms and Narrative Nation, and to assist in the development of the national promotional campaign for the Earth app, a digital birth tracking app for birthing women of color. She is former president of the San Joaquin County Breastfeeding Coalition and a current board member. Eric is also the co-founder of Flourishing Families Incorporated, a 501c3 committed to addressing the needs of breastfeeding and birthing families in Stockton and beyond. Also, Erica enjoys participating in breastfeeding advocacy opportunities with several organizations locally and at the state capitol. Come on, give it up for Erica. We have our queens out and they got their crowns, and let me tell you, they are glowing. And you always need a partner when you're pursuing social justice. Tamisha Turner, IBCLC, co-founder of Flourishing Families. Tamisha is the wife and proud mother of three amazing young Black men. An IBCLC and doula residing in Stockton, California, Tamisha has over 21 years of experience in the WIC program and working with expectant and young families in the community, providing direct lactation services. She's known for her passion for Black breastfeeding and community collaboration, including teaching and mentoring aspiring lactation and birth worker professionals. With her unique perspective, having navigated the health care system as a Black teen mother, and her journey from WIC breastfeeding peer counselor to IBCLC, she has gained invaluable knowledge and wisdom to support her clients. With her exceptional experience in developing and facilitation an equity-based learner-centered breastfeeding education and training for local WIC staff, peer counselors, lactation professionals, community leaders, and organizations specializing in group education and advocacy for birthing families. Tamisha has served as a mentor and educator for aspiring with the lactation and birth work professionals across the state of California, including the Black Infant Health Program, California WIC Association, CDPH WIC, UCSD Lactation Education Extension Program, Black Mothers Breastfeeding Association, Public Health Advocates, and most recently, RSSC. For 4 consecutive years, she served as the co-chair and the host of the annual California Breastfeeding Conference for the state of California. Additionally, she has served on the planning committee and co-hosted the 2021 Black Mothers Breastfeeding Association virtual conference, the organization founded by Black Breastfeeding Week. As a proud third generation Stocktonian, she was recognized by the California State Legislature in 2018 for her work with African American women in San Joaquin County, and as a lactation consultant and health advocate in women and children's health. Fueled by her passion to make a difference, Tamisha, this is wonderful, founded the nonprofit organization along with her co-founder, Flourishing Families, whose mission is to give voice to birthing Black families, connect them with resources, and advocate on their behalf. In her current role as the WIC Regional Breastfeeding Liaison for San Joaquin County, and the Sister Coach program manager. She is working to build a network of continuous breastfeeding support and care for all birthing families. She believes that breastfeeding starts with cultivating a true village of support and says a mother may nurture her child to grow, but it takes a village to make them flourish. Come on now, you didn't stole that quote. You made that quote. That was wonderful. That was a wonderful introduction to both of you queens. I'm going to start with you, Miss Erica. Tell us about your work in the community and what you want to tell us today and share with the community today.
Well, one of the things that's important, thank you so much, RC. One of the things that's important to me is that when we hear stories in the community of um, just situations, experiences of care in healthcare settings, that really a lot of times ruffles my feathers. And I just think, what are some of the ways that we can encourage um, and communicate patient advocacy, when you're in that moment? So making sure that mothers, that families are prepared, so that they have better experiences, and so that they are not afraid to have those interactions. So patient advocacy is really important. And then sharing those stories, like I shared before, at the state level, making sure that folks know and that those stories are communicated both within the community and then to our local and state, um, you know, uh, um, law providers, so that we're making sure that we're connecting those dots, because we want to see those things change. So
Thank you for that. And so, Tamisha, how do you all work together in supporting your mothers? What can they expect when they come into flourishing families? And tell us where we can find you.
Okay, great. So first and foremost, the focus is mama, right? Focus is baby, but really centered in the family. So when you come to get support from us, you are know that you're going to be heard. First of all, you're going to be seen. And we are here to meet the need that you have. And sometimes, we educate, and we don't take a pause and really see, the bigger picture of the whole person. Know that women don't breastfeed in a silo, right? There are fathers there, there are partners there are grandmothers there are aunties there's TTs there, right? And so everyone that is involved in that child's, that potential child's life needs to be given a space, right? And support as well. So what we can't support you with, we will connect you with. And if there isn't something to connect you with and you have a need, then we will help to facilitate to build that thing, just like we did with our doula support and some of the doulas that we have now here in the community. Shout out to Diamond and Chrissy.
All right.
Yeah, they were a fruit of us listening to the community. We had a mother in our community that said, the hands. I wanted a black. She wanted a black doula. She literally said she wanted the first hands to touch her child to be that of a black woman. And there were no midwives, no doulas, or any birth support in here that looked like her in this community. And that was 2000. Was it 21? Okay. And so then, fast forward the end of that year, we were able to, with the support, right, of public health advocates, the REACH program, help to facilitate these mamas getting that training, so that now we have 2+ and more Black doulas in our community.
Yes.
Yeah. So that's the kind of support that we provide to our mamas and families in our community. Where can we find us, right?
Yes. Where can we find flourishing families?
Yeah. So we are here at the Huddle Co-work. We are in Suite 316, right next to the Birthing Tree Lactation Space, which we are just up there right now having an amazing conversation with some expecting parents. And so at that space in the Birthing Tree, it's actually 317 is the suite, third floor here at the Huddle Co-work. We have monthly breastfeeding support groups as well. So,
And that's called the Motherland, right?
yep, the Motherland Breastfeeding Support Group for Black moms and babies.
I love it. And so I know you cater to Black moms and babies, but that's not always everyone that needs
No.
our help. Can anyone come and join?
Oh yeah,
All right.
absolutely. You're more than welcome. Know that culturally it's kind of a vibe, but you're more than welcome to come. And even our brown sisters, there's a lot of disparities in that community we don't necessarily talk about,
Right.
And there's so many benefits. Those things that we talked about, like the benefits of breastfeeding for the infant and the mother, that extends beyond just your race or ethnicity, right?
Yes.
And so the support piece as well, right? When we look at the research, a mother who has a village that is supporting her with breastfeeding is going to be more successful with breastfeeding. She's going to breastfeed for longer, so longer duration, and she's also going to be breastfeeding exclusively, right? So more exclusivity, which is when we see all those wonderful benefits, especially for mother, that were mentioned earlier.
I love it. So this question is to Erica. Erica, you travel a lot. You are now in your year where you're connecting, you're advocating. Can you share with us here, in comparison, what's happening in our county, in the city of Stockton, what's happening in other places in the nation?
Absolutely. What we're seeing is that the numbers are consistent. So, where in the state of California, here in San Joaquin County, uh, it's, Black women have the highest rates in the state of California. That's consistent across the country. Even in New York City, it's been 12 times the rate of white women who have died in hospitals. So these numbers, they're extraordinary. Nationally, the numbers are 3 times the rate. So Black women are dying 3 times the rate of white women. And so, you go to Detroit, it's anywhere from 8 to 10. If you go to New Orleans or Louisiana, the numbers are extraordinary as well. I did some work there several years ago, and just talking to the moms, the things that they would say, their experiences. I don't want to have, a mom who's like 24, 25 years old. I've had one child. I don't want to have any more children. So just hearing those stories and saying, gosh, what can we do? We have a young woman who is of age and was excited to have children and now is not. So when we look at those numbers, they're very consistent across.
They're very consistent across. So we have a work to do. And I think in this political climate, I think that's what scares us, right? We're not allowed to say equity. We're not allowed to say that there's systemic racism or implicit bias or just not cultural humility. Like when your doctor or your nurse just won't hear you out because they think you're poor, they think you don't know what you're talking about. There's a hierarchy complex. That's an issue. And I appreciate, our former speaker that came up here, and when she talked about how there's education and training going forth to make sure that's not happening. Dr. Adrienne McIntyre from San Joaquin General Hospital. When we're talking about that, I think it's important and it's an essential. And I'm going to keep pushing it as a social justice advocate because these numbers have to be explained. We know that systemic racism in the United States came from the enslavement of other people that were not white. And it was not just only Black people, indigenous people, brown people were ran out of their regional places, their homes. And so the importance of legacy building, the importance of breaking generational poverty, right? And stabilizing that full family is important also to this process. And as activists, we have to teach, we have to educate, we have to stay concerned. Tell us, please share with us before we leave today how you would encourage every service provider, every nurse, every lactation specialist on how to maintain in the fight because it gets to the point where you do feel an apathy that's happening. When you're constantly seeing the disparities, you're constantly seeing the statistical rates. We have to keep the faith. So share with us, encourage us one moment in time.
I'll go quickly. I'll say that joy is a form of resistance.
Mm.
So making sure that you're in joy. Sometimes these statistics are hard to hear. Sometimes the stories are hard, but there's stories of joy, especially when we talk about, like, when we have our the motherland group, when they meet, when we have those stories of resilience. I made it through, and or some of the education that was shared when Tamisha is working with the mom and she's, been able to get the baby to latch, and now I get to have the joy of this experience. That, joy, allows you to be able to persist. So making sure that as many of the stories that, are hard to hear, that we're also encouraging, but we've come so far. But we are having the opportunity to be highlighted. Black maternal health and breastfeeding awareness it's gained interest, and it's there's movement, and we're seeing more moms and babies that look like us. We're seeing more healthcare workers and providers that look like us. There is traction around it. There is funding coming, like we heard earlier today, that's going to continue to propel that forward. So we can't get lost. We have to keep advocating, because there's a mom out there that says, I want to be heard. I want to feel safe.
Right. And
so
it may not know how to talk up.
Right.
So we got a model, right?
Right.
Even when it's scary for us as service providers. I thank you for that, my sister. Thank you for that. Tamisha, as a vet now, you know what I'm saying? I mean, you be giving me the jewels, but I pick up every gem that you drop, and I go to you often to get consult. When I hear these stories and I got to go in these rooms, I got to go advocate for funding or support, I come and I talk to you, right? So, how do you tell us to stay encouraged? How are you telling our mothers tonight how to stay encouraged?
Oh, that's to me, it's really heavy because it has been so many years and so many stories, and we carry those things within us, right? But it's okay to hold space for yourself, and it's okay to hold space for others. And in doing that, you you get to celebrate the joys that Erica was talking about, but you also get to digest and do something about the things that you, like what you shared with me with some of the mothers that you've helped to support and advocate for. You have to uplift those stories. Know that for me, I'll just say this much: the joy has come in the one mom at a time. It's the one mom and baby at a time. And you may not be able to help everyone. You may not be able to be everything to everyone. You know what? As Black women, we try to do that so much. We show up so much for others without necessarily taking the time to show up for ourselves and take that time. But my encouragement is to hold space for yourself and to do that self-care and to have those reminders, right? Um, Support your sister, right? Give me a hand. Support your sister, especially when she's coming to you and she needs that safe space. Be that safe space for her without talking about her afterwards.
Adjust that crown, y'all.
Adjust the
When
crown.
nobody else is looking, adjust
Right.
that crown.
Right. That's important. We need to be safety to each other, right? Yeah. So, mamas, be encouraged. Know that you have a village of support around you. You are not alone. And don't be afraid to hold space for yourself.
Thank you. And plug where we can find you one more time.
Yeah,
It's
absolutely.
important to be connected to you.
Yeah, absolutely. Here at the Huddle Co-work, we're on the third floor, which is Suite 316, Flourishing Families. And we'd love to have you there at one of our support groups. And or if you're needing lactation support, as a lactation consultant vet, I'm here to provide direct services and get them babies breastfeeding by any means necessary.
I love it. I love it. So before we go, I'm going to ask our health equity coordinator to join us on stage along with our intern. Um, I would love for her to just talk about the great work that our interns have been doing. It's important, just like Dr. Adrian McIntyre was saying, just like Congressman Josh Harder was saying, we have to support the workforce development of our new workforce. That's going to help with deconstructing some of the implicit bias that we see, the practices that we see. And it starts with putting an intern and accepting an intern within your community based organization or your hospital someone that is exposed early on, that can support and advocate. And I just want to tell you, thank you. Thank you so much for the work you've been doing. It is important that we continue this work. And as we leave here, I want to give all the gifts out that we have to our remaining families. It's important that we see you. I have Fabian, I have Duce, I have Kenya, I have Nicole. If you're still in the building, and if it's anyone else, please come up. Enjoy your gift because, we have to do that for our families. We have to show them that we appreciate you. Yes, and before you go, give them the microphone. I want you to get into the frame here. Fabian, you can have a seat right here next to our intern. Okay, awesome. Go ahead, Fabian. Go ahead and come on up. And we have our intern who's going to be supporting with translating. You might have to step a little bit forward than that. There you go. And so you're back in the frame here. And so you came today, Fabian. Who did you join? Mhm.
Can you repeat the
Yes.
question?
So you came here today, Fabian. Who did you join here today to support?
Hola Fabián, hoy viniste, ¿con quién viniste y con quién viniste a soportar?
Oh, con Perla, no, con Dulce y Marta.
¿Y quién son ellas?
Pues mi tía, mi hijastra y mi pareja.
With my aunt, with my stepdaughter and my partner and her aunt.
I love it. You brought the whole familiar out. Come on, Fabian. That's how you supposed to do it. Support our women when they come out and they support and advocate for themselves. And I see you got a gift here. Won't you introduce yourself?
This is for my niece.
Okay.
I bring him to.
Oh, I love it.
Yeah, I'm so glad he stay here, and I'm so glad coming to the community and everything help for everybody here.
Thank you so much. And I hope you enjoyed yourself. Please take these gifts and support.
Dulce is one of the community health workers that is currently being trained through Stanislaus State.
And I'm so glad because it's a beautiful teacher, it's a beautiful trainer, and I'm so glad to stay here and I go to that class and I'm so glad he's in that group.
Oh my goodness. This is a wonderful historical moment to see. Shout out to Cal State Stanislaus and Health Plan of San Joaquin, who gave $1.7 million to Cal State Stanislaus to train our community health workers. And if you're interested, please join in the fight to support our health disparities decreasing. Reach out to Kim Robinson, our health equity coordinator, to support connecting with those classes. Thank you, Dulce, for coming. You are our next CHWs.
Yeah, and I thought no scared. It's so grateful to stay there and no scared to come to the class.
Yes, I
So
love
beautiful
it.
over there.
It's a great class and it's
Yes.
taught by our local leaders, Kimberly Robinson and also Sheree Wilburn, who is one of our activists here for the Black Birth Equity Initiative. I want to thank you both for coming today.
Thank you so
Thank
much.
you.
Appreciate it.
Thank you. Please take a gift for yourself as well if you like it. And we have our mother coming up here. Are you a mom to be? Okay, please have a seat. I never want to assume anything. And so, what is your name?
My name is Kiera Shabazz.
Kiara Shabazz. So, Kiara, you're from Stockton, California? Okay, where are you from?
I'm from East Oakland, California.
East Oakland. All right, East Oakland is in the house. That are our distant cousins that we call them. And so, how long you been in Stockton?
Since 2014.
2014. All right. Well, you a Stocktonian now. 10 years you've been here. I love that y'all Bay Area transplants say, I'm not from Stockton. I said, y'all are now. You're living here over 10 years. You're from here. So what are you having?
I don't know what I'm having just yet. I do plan on having a gender reveal next month.
Okay,
Yeah.
awesome. So you're one of them mamas that want to prepare and want to know. Because I didn't do no gender reveal. I was like, I'm getting my nursery together. I need to know what I'm having. That's awesome. And so, do you plan to breastfeed?
I do.
Okay, yay! We can congratulate Mama on breastfeeding. I want you to bring that mic to your mouth because we got to hear from you. What are some? Is this your first baby?
This is my first baby.
It's your first baby. Okay. Well, you have some doctors, you got some advocates that are in here. What are some of your concerns that you may be struggling with, or if you're scared about going into your pregnancy?
I feel like so far, some of my concerns have been like, being that we are African American, and I feel like a lot of we are like always put in a stigmatism of like we don't know certain things, and so like a lot of times when I do go to doctors, they're like, "Oh yeah, that's normal," but it's like this is a concern, and
It
I
is
want my concern to
concern.
be heard.
And you want to be heard, and you slow them down when they do that because they seen 100 patients over a month sometime through telehealth, over the phone, connecting to other clinics. If they're a delivery doctor or a gynecologist, and y'all start blending together. I hate to say it, but that's how it is sometimes in service providing. So you need to know how to advocate for yourself. So you slow your doctor down and you allow that time and that space to happen within your appointment. And you ask any concern because guess what? They're charting those concerns. And you make sure that they hear you and get connected to a CHW, a doula. We've had them here in town, and also in this place here. So make sure you get connected. We appreciate you for coming today, and we're excited and we would love to offer these gifts to you. Awesome. All right. I love it. I love it. I love it. And listen, when you breastfeed, I'm also going to be the good auntie and give this to you too. Ashe, because you can lay that baby on that boppy pillow and pull that tata out at night and get that baby that milk. You hear me? Because you're going to be tired the first couple of weeks. You keep yourself with your extended family, keep your support going, and open your mouth and advocate for you and your baby. I thank you so much. All right, y'all. We are done for the day. We are done for the day. I am so excited. I am so happy that we were able to be able to stream live with you. If you have any questions on even how you connect with the Prune Tree podcast, reach out on Facebook or Instagram and support connecting communities and also changing the narrative. We have to get the campaign and information out there to support our mothers, our babies, and our family members. Thank you to the Lactivists and thank you to all of our guest speakers today. I am Rebel Ray coming to you live from Huddle Co and Create, and we thank you. Good night, peace, love, unity.
Good night.